Okay, now what we want to do is define all the knobs very carefully. So the first control that we're going to set is pressure. The pressure control is the primary control that affects the delivered volume. So remember, the higher the volume, the higher the pressure we set, the higher the volume that should be able to achieve. What is very patient dependent is how is the patient's compliance. Patients with a very low compliance or really stiff lungs, maybe somebody with pneumonia or fibrosis, is going to take a high amount of pressure to deliver a large enough tidal volume to really open up those collapsed alveoli. So it's not unusual to use a pressure of up to 30 centimeters of water in these cases. The pressure, then, the machine will shut off or cycle from inspiratory to expiratory when the pressure in the circuit has reached whatever pressure we have set. So if we set a pressure of 15 centimeters, the machine is going to deliver inspiration until the 15 centimeters is reached. Once that pressure is met, the flow shuts off and the machine cycles to exhalation, and again, exhalation is passive. On the machine, there's going to be a manometer to read those exact pressure values. So we start the pressure at around 10 centimeters of water and gradually increase the pressure to the highest pressure the patient can tolerate, or within whatever guidelines the department has set. If the patient's already been using Ippb, it's important to look at what the last therapy pressure was and maybe start a little bit lower than that, but try to work up for that pressure that was used the last time, or get a little bit more pressure. We will use lower pressures on those patients that are not as awake and alert, because we do have that risk for aerophagia, or the swallowing of gas, in these patients. The next control that we will set is the flow control. And what the flow control does is it affects inspiratory time. So the faster the gas goes to the patient, the shorter the time that's required to reach that pressure. So again, this is like speed of your car. If you have to drive 10 miles, the faster your speed, the shorter time it will take you to travel 10 miles. So if you travel 10 miles going 30 miles per hour versus 10 miles going 60 miles per hour, you're going to get there twice as fast if you're going 60 miles an hour. Meaning your travel time will be reduced at higher speeds. It's the same thing with flow. The faster the flow rate, the shorter the inspiratory time. The faster the flow rate, the shorter the inspiratory time. The slower the flow rate, the less flow we deliver, the longer inspiratory time is. Sensitivity is the amount of negative pressure that the machine has to sense or see before it will trigger inspiration to begin. So in other words, the patient must kind of see the patient's inspiratory effort. Because if we go back to the definition, we want the patient's intermittent positive pressure ventilation. We want this to be intermittent for when the patient's using it. Inspiratory, so it's delivered during inspiration. Well, how do we know the patient's inspiring? We know it because the machine senses a really small pressure change by looking at the patient's effort, and that's when inspiration begins. So we set a sensitivity level. The sensitivity is a negative setting. So we set a negative pressure of maybe -1. That's where we would start. And if you think of -1 versus -10, -1 is a more sensitive pressure setting than -10. Because at -10, the patient has to do more work or suck an effort of 10 centimeters of water before the machine would trigger a breath. Air mix. Air mix generally is it's kind of like a Venturi type device where it mixes room air in with the air that's being delivered from the machine. So the machines are hooked up to a 50 psi gas source, most of the time oxygen. It can be air, but so we have a gas source through a 50 psi pressure cable. But then we also have an air mix control on the front of the machine that will mix in atmospheric air with whatever air is being delivered through the device setup. These machines are pneumatically powered, meaning we have to have a gas source to hook them up to. I should say the machines we're primarily going to use in Boise and in our lab are the Bird machines. Those machines require a gas source.